Region beefs up protective measures as African swine flu confirmed in the Americas. CARICOM launches 2020 round of population and housing census. And CARPHA urges countries to interrupt transmission and reduce mortality associated with the COVID-19 virus. These and other stories are in this week's episode of the CARICOM News Time. I am Tusankin English Francis. Thank you for joining us. The Caribbean Agricultural Health and Food Safety Agency, CAHFSA, is urging CARICOM member states to intensify protective measures against the African swine fever, ASF, which has been confirmed in the Americas.
The disease causes up to 100% mortality, and so it devastates your swine industry. And countries that are affected, there is then a limit put on your export of pork or pork products from your. So if your country has a well-developed swine industry, you could imagine the effects or the economic impact that can have on your potential for exports if this disease enters the region. And not only for exports, but for local consumption. Our industry produces meat for local consumption. So if the disease enters our country, one of the normal control measures that is applied is stamping out or slaughter all of the animals. So you can imagine if you have to eliminate all of your breeding stock, all of your population of swine, how much that can put or set back the country's swine industry.
The African swine fever is a highly contagious hemorrhagic viral disease of domestic and wild pigs. It has been reported in the Dominican Republic. Authorities there said they will slaughter tens of thousands of pigs from farms across the country to stop the disease.
We speak of the Dominican Republic, but I just want to remind us that is an island shared by two countries, the Dominican Republic and Haiti. And as such, we need to pay attention to travelers coming from both countries or from the island of Hispaniola into our member states. Informing them not to bring pork or any pork products into the country. So we need to increase surveillance at all ports of entry. We need to also look at how we treat with international garbage coming into our ports, be it from the cruise ships or from at the airports. Those garbage, and especially anything that contain any pork or pork products, we need to have them incinerated or taken to be incinerated, preferably on the premises of the airport, so that nothing leaves that premises.
According to CAHFSA, ASF is a transboundary animal disease that can spread from live or dead pigs, domestic or wild, and pork products, contaminated feeds, and objects such as shoes, clothes, vehicles, and knives. CAHFSA said the CARICOM Committee of Chief Veterinary Officers recently discussed the threat and recommended that countries increase border surveillance. The committee also recommended that countries activate or update national disease emergency contingency plans and intensify coordination among partner agencies.
We need to look at our diagnostic measures, protocols, our laboratory capacity, those of us who have, how can we improve on that? Those of us who don't have the laboratory capabilities to diagnose the disease, how can we then send samples? So we need to have personnel who are trained or IATA certified so that they can then be able to send our samples. We need to know the reference laboratories and have agreements with them so that we can then readily take samples and send to them.
The 2020 round of population and housing census has begun in the Caribbean community. Barbados started its national immunization exercise on the 1st of August. Grenada, the Bahamas, and St. Kitts and Nevis will commence their censuses in September. A virtual event aired on the 3rd of August raised awareness of the exercise that is regionally coordinated by the Regional Statistics Program to enable its implementation and to ensure harmonized quality data to inform national and regional policies. The event featured Champion for Statistics in CARICOM, Prime Minister of Grenada, the CARICOM Deputy Secretary General, and partners supporting the development of statistics in the Caribbean. Here are the highlights of the launch.
This is the largest statistical exercise a country can undertake, and the involvement of all its citizens, including youth and women, differently abled, senior citizens, agriculture workers, farmers, etc., is required. It is a region-wide launch because the census in the several CARICOM countries is regionally coordinated to enable its implementation and to ensure harmonized and high-quality results. I must recognize the hard work of all the statistics bureaus involved, but being from the CARICOM Secretariat, I must express my sincere appreciation to the Director, Dr. Harrison, and the staff of the CARICOM Secretariat Statistics Department. Through this regionally coordinated approach, we are adhering to the principles contained in the CARICOM Regional Strategy for the Development of Statistics, RSDS, which our heads of government have approved. Some of these principles are cooperation in solving common challenges, sharing of lessons learned, pooling of statistical skills, conducting training region-wide, and sharing of equipment, expertise, and resources.
Sisters and brothers, undertaking the census in CARICOM countries at this time is indeed a defining moment. In addition to its inherent value in better informing the decision-making process, in times of natural disasters such as the recent volcanic eruption in St. Vincent and the Grenadines, or the intense hurricanes and extreme floods of recent years that have ravaged many of our islands, the census can provide critical data and knowledge about the smallest, most remote areas. In times of crisis, the census can provide answers to questions such as how many persons will have to be relocated, what buildings are available for relocation, are there persons with special needs who require support during relocation, where is the infrastructural support for the mobilization efforts in these small areas. The census will also enable us to begin addressing issues related to gender equity, the elderly, food insecurity, and internet access.
The Caribbean Public Health Agency, CARPHA, is urging countries in the region to continue their focus on interrupting viral transmission and reducing mortality associated with the COVID-19 virus. As it says, all 4 variants of concern are reported to be in the region. In its 179th Situation Report, CARPHA says most countries are making considerable progress in vaccine rollouts, but countries should maintain active surveillance, testing, and COVID-19 prevention and control measures, including physical distancing, hand hygiene, and the wearing of masks. Over 14,330 deaths have been recorded in the Caribbean region, with the total confirmed cases steadily increasing from 1,145,597 as of the 29th of July. Meanwhile, CARICOM countries have been ramping up efforts for vaccination coverage. In new guidelines announced recently by the National Task Force of Guyana, all providers of public transportation should be vaccinated. Members of the public who wish to visit a ministry or a government agency for a service and all foreign nationals seeking entry into Guyana will have to show proof of vaccination. Teachers are also being urged to get vaccinated to facilitate the safe reopening of schools in September. Guyana's vaccination program recently received a boost from the United Kingdom with a donation of 84,000 doses of Oxford AstraZeneca vaccines. The gift is part of a wider global donation of 100 million vaccines to the COVAX facility and directly to countries. Other countries in the region, including Jamaica, are also expected to benefit from the UK donation. In St. Vincent and the Grenadines, the government on the 5th of August piloted an amendment to the Public Health Bill of 2021 to allow it to require vaccination of certain categories of frontline workers. CARICOM heads of government at their regular meeting in July urged that employees cooperate with employers to ensure a safe working environment, either through vaccination or regular testing. Heads of government also emphasized the importance of citizens being inoculated so that member states could achieve herd immunity, recognizing that no one is safe until everyone is safe. As CARICOM countries ramp up COVID-19 control measures, the government of Dominica has introduced new restrictions. Prime Minister Roosevelt's Carrot announced a 6 p.m. to 5 a.m. curfew from the 3rd of August and continuing for 7 days in the first instance. Even as several member states of CARICOM marked Emancipation Day 2021, observing 187 years since the abolition of slavery, the United Nations General Assembly unanimously adopted a resolution establishing the United Nations Permanent Forum for People of African Descent. The 10-member advisory body will work closely with the Geneva-based Human Rights Council, serving as a consultation mechanism for people of African descent and other stakeholders. It will also contribute to the elaboration of a UN declaration as first step towards a legally binding instrument on the promotion and full respect of the rights of people of African descent. Remember, for the details of these and other stories, you can visit the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org. Like our Facebook page, follow us on Twitter, and be sure to subscribe to our YouTube channel. Thank you for watching. Be safe and see you next time.